Hello viewers, I'm Dr. Pankaj Walecha and today I will talk to you about severe osteoarthritis of knee or advanced osteoarthritis of knee. It is usually called the stage 4 arthritis. Now in this stage, there is global loss of the cartilage from the knee joint. Global means a big chunk of the cartilage is lost. As you can see in this model, this blue thing is the cartilage. This whole segment of the cartilage, at multiple places it's gone. So the patients present to us with crepitus, which is very painful. They have gross deformities. They have pain even on doing movements at rest. At this stage, the cartilage is completely eroded, and in fact in some neglected cases, the subchondral bone is also eroded. So these patients have lost their independence. They are largely housebound. Most of these patients would benefit by a total knee replacement surgery. But before we do the surgery, we have to plan the surgery. So we do a standing weight-bearing X-ray for these patients to assess the amount of bone loss so that we can plan the type of prosthesis which is needed for the patient. Sometimes they need additional components also to be put in the knee replacement surgery. That depends on the type of bone loss they have. Typically, these patients take few days to be evaluated and to be optimized for the knee replacement surgery. We utilize these days in doing what we call as prehabilitation or prehab. In this, our physical therapy team helps the patient in doing certain knee exercises so that they can gain some strength in their muscles and some flexibility in their knee and some reflexes. This prehab helps these patients immensely in recovering faster after the surgery. A knee replacement surgery is done to remove the eroded part and the dead bone from your knee joint to be replaced by a new artificial joint. Let me show you how. As we know that the cartilage is completely eroded, in this model you can see a prosthesis has already been put into the knee joint. This is the thigh bone, this is the leg bone. Let me remove it for better understanding. So in a normal knee, on an X-ray, we see that there is equal gap between the thigh bone and the leg bone. But in advanced arthritis, there is gross deformity and the bone is grinding the bone. When that happens, we have to go in and clean the lower end of the thigh bone with specific instruments, which are very, very precise. And then we replace a cap onto the lower end of the thigh bone. Similarly, the upper end of the leg bone is also cleaned, and a special kind of a plate and a plastic is put there, and the knee is brought back into position. So now the bone is away from the bone and the deformity is corrected. So when the patient moves, there is no pain because the bone is not grinding with the bone. So friends, there are three clear advantages of doing a knee replacement surgery. 1, the deformity of the knee is corrected. 2, the pain which was coming from within the knee joint is gone. 3, the patient's walking speed increases as they do physical therapy and exercises after the surgery. And this helps them in regaining their independence and regaining their confidence. Usually patients require a physical therapy for 2 to 4 weeks, and in a period of 2 to 3 months, most of these patients are back into their normal lives. Thank you very much.